My name is Stephanie McIntosh, and I'm a family nurse practitioner student at South University, and I'm going to be performing your head to toe assessment. I washed my hands before I came in the room. Could you tell me your name
Tyler McIntosh,
and your birth date?
October 3rd, 1995,
Can you tell me the year?
2018,
And where are you right now?
Burnsville, North Carolina.
Good. I checked her height and weight and her BMI and her vital signs prior to coming into the room. Her height is 5'4", her weight is 160, her BMI is 27.5, and her vital signs are normal. I want to assess your skin right now. The color is normal for ethnicity. Her skin is warm and dry, no lesions or any areas of concern that I can visualize. She is well groomed and appears to be in no distress. So now I'm going to check your head area. I'm going to check your scalp for tenderness, for lesions, for anything out of the ordinary, any masses. Everything feels okay. Do you have any tenderness?
No.
Okay, good. And your hair distribution is even. Don't see any areas of baldness or anything like that. Okay, I'm going to palpate your temporal arteries here. Do you have any, your temporal pulses here, do you have any tenderness?
No.
Okay, and now what I'm going to do is I'm going to get you to clench your jaws. I want to check your cranial nerve 5. This is the masseter muscle and your temporal mandibular joint here. Okay, so if you will, just clench your teeth. And what I'm feeling for is a contraction in your muscle here. Okay, let go. Okay. Do you have any tenderness or pain here?
No.
Okay, good. Okay, now what I want you to do is raise your eyebrows. I want you to smile and puff your cheeks. Okay, good. Now we're going to use this Q-tip with a sharp and a dull side. So I'm going to get you to close your eyes and tell me what you feel.
Dull. Sharp. Dull.
Excuse me.
Sharp.
Okay, good. Okay, now I'm going to, well, we've already actually assessed the cranial nerve 2. Tyler used the Snellen eye chart and we assessed her vision, and she had 20/20 vision, and that's with her glasses on. So now I want to assess your excuse me, peripheral vision using confrontation, okay? And what I'm going to do is I'm going to get you to look at my nose, and I want you, through your peripheral vision, to tell me what numbers you see, okay?
2, 4, 2, 2.
Good job. Okay. Now I'm going to assess the 6 cardinal fields of gaze, okay? And this time I want you to actually follow my finger, okay? You don't have to just look at my nose or anything. I just want you to follow my finger with your eyes. I don't want you to move your head, okay? Good. That was good. I didn't see any of the nystagmus where her eyes were jerking or anything like that. Okay, now I'm going to be assessing cranial nerve 2 and 3. I just want to look at your pupils and the size of your pupils and just see how that looks. I want to look at your iris and your cornea and your conjunctiva. Just noting what I find out or what I see about that, okay? Okay, your pupils, they look about 4 millimeters. Each pupil does. And what I want to do now is I'm going to, if you don't care to take your glasses off. Okay, so I want to shine the light in one eye. Okay, and it was brisk, and it was dilated and constricted really well. Okay, now I'm going to shine the light in this eye. Good. It's the same. Okay, so this time I'm going to shine the light in this eye, but I'm going to look at this eye, okay? One more time. Good. And that eye constricted as well. Okay, both eyes are working together. This time I'm going to check for accommodation. What I'm going to do, I want you to look at my finger, okay? All right, and I'm just going to move closer. You just focus on my finger, okay? And her eyes constricted as my finger got closer. So normally at this time I would use an ophthalmoscope to check for the presence of the red reflex, and I would also check the vessels and structures of your eye using the ophthalmoscope. It allows you to get really close and be able to see inside your eye while your pupil's dilated. So now I'm going to check your ear. Okay, I'm going to just look at the outside auricle of your ear. Okay, the external ear. And everything looks good, just the way it should. Now I'm going to do a whisper test on you, okay? I want you to close your eyes. I want to go about 5 feet away from you, and I'm going to say a word, and I want you to be able to repeat that word to me, okay?
Purple. Red.
Good job. Okay, I would also, if I had a tuning fork, I would assess the lateralization of sound using, that would be called the Weber test. And what I would do is I would strike the tuning fork and place it at the center of your head, and I would ask you if the tone is louder in the left ear or the right ear, or if the tone is loud in both ears. And so a patient with conductive hearing loss, the sound would get louder in the affected ear. And a patient with sensory neural hearing loss, the sound would be louder in the normal ear. And a normal person or a person with symmetrical hearing loss, it would be equally loud in both ears. And so another test would be the Rhine test. It determines the conductive hearing loss. I would also use the tuning fork. I would strike the tuning fork and I would place it on your mastoid process right here behind your ear. And so when you could no longer hear that, on your mastoid process, I would take the tuning fork and put it to your ear canal. I wouldn't touch it, I would just put it to it, and then I would just see how long it takes for you not to be able to hear the sound. So a normal hearing will show the air conduction is twice as longer as the bone conduction. So, also if I had an otoscope, I would look inside your ear and I would look at the tympanic membranes, and I would look at the eardrum, the auditory, internal auditory canal, and your tympanic membrane should be a pearly gray color, a translucent pearly gray. And the cone of light should be on your right eardrum. It should be at the 4 and 5 o'clock position, and then on your left ear it should be at the 7 and 8 o'clock position. Okay, and so now we're going to move on to your nose. I want to check the patency of your nares. So what I want you to do is hold one side of your nares, and I want you to breathe out so I can feel it. Good. Good and patent, both sides are good and patent. Okay, now I would really need the otoscope to really look at the turbulence inside your nose, but I'm going to use this light, and I'm going to be able to look at the nasal mucosa just using the pen light. Everything looks good, looks normal. And so now I'm going to check your mouth and your teeth. So what I'm going to do is put on some gloves, and I'm going to use the tongue blade to check your teeth and your gums and your hard palate, your lips and your oral mucosa, to make sure that you don't have any lesions or any kind of discolorations or thrush or bright red patches or anything like that in your mouth, okay? So if you will, just open your mouth real wide, okay? Everything looks good. Open your mouth and say ah, ah. Okay, your uvula is midline, and I do not see your tonsils, so that would be a grade 0 for the tonsils. Everything looks good there. Okay, so I want your uvula's midline, I want you to swallow for me. You having trouble swallowing?
No.
Okay, and your voice, I talked to you throughout this exam, and your voice sounds clear. You don't have any hoarseness or crackles in your voice that I would be concerned with. I looked in the back of your throat at your posterior pharynx. You didn't have exudate, and like I said, your tonsils were not there. I couldn't see them, so that would be a grade 0. When I got you to stick out your tongue, it was midline. There was no fasciculation, no jerky movements of your tongue or anything like that. So now I want to check your range of motion in your neck. I want to actually start by just feeling of your neck here. Any tenderness in your neck or anything? Okay. I want you to roll your neck around. I'm just going to check your range of motion to the right and to the left. Okay, now just go side to side and front to back. Okay, and now I'm just going to check your lymph nodes in your cervical lymph nodes and the lymph nodes in around your ears. So this is the preauricular lymph nodes, and then behind your ears, your post-auricular lymph nodes, and your occipital is back here on the back of your neck. You also have the submental right here at your chin, right above it, and then on up a little ways, we have the submandibular, and then down below that is your tonsillar, and below your ear, we have the superficial cervical, and then so on down just a little bit farther would be your post-cervical, and the supraclavicular is right here at your the little dip right here at your above your clavicle. Okay, so next I want to check your thyroid. Okay, we want to check for enlargements or any nodular places on your thyroid. Okay, so if you don't care, just swallow. Okay, and it doesn't seem enlarged. A lot of times you can see enlargement on somebody with an enlarged thyroid, but yours looks fine. Any tenderness when I palpate this?
No.
Okay, good. Also, I'm going to check the axillary lymph nodes, and those include the central, lateral, pectoral, subscapular lymph nodes, and these are all located under your arms. And I don't feel any tenderness. I don't feel any areas of concern as far as swelling of the lymph nodes or anything. Does that feel tender or anything?
No.
Okay, now what I want you to do is I'm going to check your shoulders. I want you to push against my shoulders, my hands, try to raise your arms up. Okay, good. Just checking your shoulder strength there. And I'm going to check your the sternoclavicular areas here, and the acromioclavicular and the subacromial areas of your shoulders. Okay, good. Okay, so I want to get you to do some flexion and extension with your shoulders. So if you will, just raise your arms up and down and this way, all the way up, all the way down. Now I want you to put your, try to use your right hand to touch your left shoulder blade here, and the same for your left side. Good. Okay, now I want to check your elbows. I want to see the range of motion in your elbows, and I want to feel the lymph node here, the epitrochlear lymph node. I don't feel any swelling or anything here in your elbows. Good. And okay. And just flex your elbows. Okay, good. I want to feel your brachial artery. Good. Your radial artery. Both sides are about a +2. So I'm going to I want to check your strength in your upper arms, okay? So I'm going to get you to pull against my hands. Good. Now I'm going to get you to push against my hands. Good. All right, good. All right, so now what we're going to do is I'm going to assess your chest wall, the AP and lateral diameter, and I want to go to the side to do that. And that all looks normal. And now I'm going to auscultate your carotid arteries, which are right here on your neck, and I want to assess for a bruit. I'm going to use the bell of my stethoscope to do that. Good. Okay, good. Now I'm going to auscultate your heart sounds and listen to your valves in your heart, okay? First I'm going to listen to the aortic valve. And the pulmonic valve. Okay, and tricuspid. And just lean a little bit forward and I'll listen to the mitral valve. Okay, and that's also the point of maximum impulse is the very tip of your heart. So that would be the point of maximum impulse. And so now I'm going to listen to your lung sounds. I want to listen to the bronchovesicular sounds. And you'll find them on the right length of the sternum and the first and second intercostal spaces on the anterior. And this is all your apices of your lungs are up here, the very top of your lungs. So I want you to take a deep breath in and let it out every time I move my stethoscope. Okay. Okay. Now I'm going to palpate to feel for vibrations. I'm going to come around to the back and I'm going to get you to say 99 every time I move my hands, okay?
Okay. 99. 99. 99. 99.
Good. Okay, so now I'm just going to actually percuss back here. Okay, and so now I'm going to do a test called Gaffney, and what I want to get you to do is I want to listen with my stethoscope, and I want you to say the letter E and hold it every time I move my stethoscope, okay?
Okay. E, 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 E.
Okay, good. Okay, now the next test is called Brocaphony. And this time I'm going to get you to say 99 and I'm going to use my stethoscope and I'm going to listen as you say that, okay? Every time I move my stethoscope, you say 99.
99. 99. 99. 99. 99. 99.
Okay, and now I'm just going to listen to your breath sound. So take a deep breath. I want to be listening for any adventitious breath sounds, anything that doesn't sound normal, diminished lung sounds. listen to that middle lobe. Big, deep breath. Good. Your lungs so clear. Now I'm going to listen to or check your abdomen, if you don't mind, to lay down on the table. Okay. I'm just going to get you to pull up your shirt a little way so I can visualize your abdomen here. I'm just going to look at it first, look at the contour, look for any pulsations, and I don't see anything like that. Everything looks normal. And so what I want to do now is listen to your bowel sounds, okay, in all 4 quadrants. Okay, your bowel sounds are active in all 4 quadrants. And now I'm going to listen to the vascular sounds, okay? I'm going to listen to your aorta here, your abdominal aorta, and your right renal artery, your left renal artery, your iliac arteries, your left and your right, and your femoral arteries. They're a little ways down here. They're kind of in your groin area there. Okay, now I'm going to percuss your abdomen, okay? This is just going to let me feel to see if there's any masses or anything. First, I'm going to do light percussion. Just going to feel around here and make sure you don't have any places that are abnormal. Now I'm going to use both hands and I'm going to do some deep percussion. Okay. And everything feels normal there. While I'm here, I'm going to go ahead and feel the aorta, and that it should be 3 centimeters at the top, and as it comes down, it should be about 2 centimeters. And I don't feel any raised areas or any areas of concern there. Now I'm going to percuss your liver, span, and the edge. So what I'm going to do is I'm just going to start by coming from the bottom until I hear the sound change, and then I'll know I'm at your liver's edge. Okay, and the same way for the spleen. It's a little bit harder to percuss the spleen because it's kind of hid behind the ribs there, and you would start at your left costal margin to palpate for the spleen. And so now what we will do, I've already assessed your the abdominal aorta, and I've also did the percussion. Now I'm going to assess for rebound tenderness, and we will do this to assess for appendicitis. So when I press in and let go, do you have tenderness?
No.
And anytime throughout this exam, if you do have tenderness or pain, let me know.
Okay.
Any pain?
No.
Okay, good. So now what we're going to do is the SOAS sign, and the SOAS sign is one way to tell if your appendix are inflamed. So what I'm going to do is I'm going to get you to raise your leg, and I'm going to press down on your leg with some resistance. And if you feel pain in your abdomen here, I want you to let me know, okay?
Okay.
Do you feel any pain?
No.
Okay. And so the arbitrator sign also is a test we do for appendix. And what we'll do is I will hold your leg at the knee, and I will internally rotate it. And does that pull in your abdomen?
No.
Usually if you have appendicitis, that will cause the muscle to be pulled, and it will aggravate your appendix there. Now I'm going to palpate your urinary bladder. I'm just going to pull your pants down a little bit farther. Do you have any tenderness in your bladder?
No.
Okay, good. Okay, so what we will do now is I want to inspect your hips here. Do you have any pain when I press your hips?
No.
I don't see any edema or any deformity. You have any pain when I do that?
No.
Okay, good. Okay, I'm gonna bend your knee and I'm gonna just rotate your hips. You have any pain doing that?
No.
Okay. I'm gonna raise this one. No pain rotating your hips like that?
No.
Okay, so now I'm gonna check your knees. I'm gonna palpate your patella here. I don't see any swelling or edema noted in your knees here. So I'm gonna flex your knees. I want you to tell me if you have any pain.
No.
Okay, good. Okay, and I'm also going to do the anterior door maneuver. This checks your ACL in your knee, and I'll just hold up right here on your leg and pull like this. And if the ACL is hurt or anything, that will it will feel loose. It will feel like it's kind of disconnecting there at your knee joint. Your ankles look fine. You don't have any swelling in your ankles. Do you have any pain whenever I turn your ankles or anything like that?
No.
Okay, so now I'm going to palpate your femoral pulse, your popliteal pulse, and I'm going to do this. I'm going to go ahead and start with your popliteal pulse. Okay, good. Just checking your pulses. Good. Femoral pulses. Good. Okay, I'm going to do your dorsal pedis pulses. Okay, good. And your post-tibial pulses. And you had good pulses. They were normal. So now I'm going to test your sensation on both sides of your legs. Can you tell me if you feel that? The same on both sides?
Yes.
Okay, and now I'm going to, I want to get you to, I want to check the strength of your legs, okay? And if you want to, you can go ahead and sit up and let me do that. Okay, so what I want you to do is I want you to push against my hands. Good. Now pull. Good. Push. Pull. Okay. Push. Okay. Okay, good. Push. Good. Okay, you had good strength in your lower extremities. Okay, so now we're going to check some reflexes. I want to check your biceps reflex and your triceps reflex. First, we're going to check your bicep reflex. And what we're going to do is feel for that tendon there. And we're going to lay your finger on it. I just want you to relax your arm. And I want to strike my finger. And that will cause your hand to move. And that muscle to shorten. Okay? All right, and now I'm going to check your tricep reflex. And what I want you to do is just keep your hand really limber there. Okay, and check your triceps, and then your brachioradial. Just relax your arm. That tendon runs up the inside of your arm there. And I'll just palpate that. Okay, and then the patellar. Okay, just let your knee just hang there, and you just give that, okay? And that checks your reflexes. Okay, good. And then the Achilles tendon in the back of your leg, you just strike that, okay? Okay. And the Babinski, if you'll take your shoe off, both sides. And just hold your feet out. And that checks your reflex. Okay? All right. So So now I'm gonna assess your sensation. What I want you to do is close your eyes and I'm going to hand you an object. And I want you to tell me what that object is, okay? So hold out your hands. Okay. And so now what I want you to do is hold both palms out and I'm gonna write a number in your hand. I want you to tell me what that number is, okay? 7, 6, okay, good. Okay, so now I'm gonna do the coordination test, okay? So what I want you to do is I want you to put your fingers together with your thumbs, each finger, and come back and forth. Okay, good. Okay, now if you'll just stand up, I'm gonna assess your spine and your range of motion in your spine. And if you will, just bend forward. Good. And rotate your hips. Okay. And now I want you to put one foot in front of the other and walk. Good. Okay, and now we're going to do the pronator drift test. I want you to put your hands straight out, close your eyes. Okay, and I'll see if you sway or anything, or your hands sway down, and they don't. And then the Romberg test, I want you to put your feet together and close your eyes. And if you feel like you're swaying back and forth, good. And this concludes our test.